Let me echo my gratitude to all of you for your patience. We've had a series of votes on the Senate floor this afternoon as we consider this funding bill for military construction in the VA, which I have prepared with Senator Bozeman, this bipartisan funding bill, which is going to have, by the way, a significant impact, positive impact on military installations across Georgia and in many of your markets and areas of reporting. So we're happy to give you more information on those developments as the week progresses and the bill moves its way through the floor. But today I want to sound the alarm on the impact of this recently passed Trump budget bill on seniors in Georgia and on nursing homes in Georgia. As you're no doubt aware, it's the most significant cut to the Medicaid program in American history. At a time when 70% of Georgia seniors in nursing homes are covered by Medicaid. Independent public health studies have sounded the alarm that this puts dozens of nursing homes in Georgia potentially in financial jeopardy. And we're talking about our seniors, the elders in our community, those who need care, who need support, our parents, our treasured grandparents, and loved ones. And this is a serious threat to the health and well-being of Georgia seniors. So again, my purpose here is to inform the public and to sound the alarm that this Trump budget bill that's just been passed into law, which guts the Medicaid program, that covers 70% of Georgia seniors in nursing homes, is a serious threat to seniors' health and well-being in Georgia and to Georgia nursing homes. And I'm happy to take questions from members of the press on this or any subject.
Thank you so much, Senator. Again, we'll open it up now for Q&A. Feel free to use that, click the react button and do the raise hand button toward the bottom. And also pop into the chat if you'd like to ask a question and we can go from there. We'll start with Lucinda and then we'll get to Shay and Antoinette. Lucinda, over to you.
Hi there. So do you guys have any estimates on how many people these nursing homes in Georgia serve?
Lucinda, I'd have to have my team follow up with you with those kinds of numbers if we have them to hand.
Okay, thank you.
Are you referring to the Brown University School of Public Health study?
Yes, the one that was linked in the press
that is
release.
not a study that my office prepared. I don't know whether we have that information, but I think an important point that I want to make again, and you've heard me make it over and over again, is that 70% of seniors in nursing homes in Georgia are covered by Medicaid. And in addition to posing a serious financial risk to hospitals and clinics, this law poses a serious financial risk to nursing homes, not just in Georgia, but across the country.
Great, thank you.
Perfect. Thanks, Lucinda. We'll follow up on that point. We'll go over to Shay.
Hi, Senator. I hope you're doing well.
Hey, Shay.
This is kind of a Savannah specific question, but over half of the nursing homes in the Chatham and Bryan County area are already rated below average or much below average by the standards of the Centers for Medicare and Medicaid Services. So they're obviously already struggling to provide, a decent standard of care. What do you see these cuts doing to some of these facilities that are already struggling with the funding that they're getting now?
It's an important point, Shay, that Georgia already has a senior care crisis. The fourth lowest rate of nursing coverage in the country. That's hours of care per resident per day. Fourth lowest rate in the country. Georgia nursing homes are already struggling. Georgia seniors are already struggling. And here we have this law that is going to deepen their struggle, put seniors at risk, put nursing homes at risk in a situation where Georgia seniors are already at risk and struggling to get the care they need.
Perfect. Thank you, Shay. We'll go over to Antoinette, and then we'll get to Tia, Sarah, and Tamara.
Thank you so much, Mr. Best. Can you hear me, Senator? How are you, by the way, sir?
How are you, Antoinette?
Doing well. Yes, sir. Just on behalf of my station, we would like to know one of the 37 Georgia like nursing homes, is Early County considered a part of the nursing homes that's being at risk?
Antoinette, I have to get you follow up on that. Again, I can't speak to the details of the School of Public Health at Brown University's study beyond what they've published. It's one of, I think, a significant number of assessments produced across the country over the last several months, indicating that there will be severe financial jeopardy and hardship for nursing homes in the United States as a result of this law. As for any specific facility or county, let me have my team follow up to the best of our ability.
Oh, absolutely. And I'm so sorry about the question too as well.
No, no, not at all.
Yes, sir. Thank you.
Thank you, Antoinette. We appreciate it. Tia, over to you.
Jake, I just put in the chat that my question is off topic. So if you want to take the questions from people on the topic, I can wait.
Okay.
Sure. Sarah, over to you.
Good afternoon, Senator. I know you can't speak directly to that study from Brown University, but three of the nursing homes listed were in some of our more rural counties here in Southeast Georgia, Tattnall and Liberty. I just wanted to ask you, what is your kind of stance on this topic, especially with, those rural counties where they already are most likely struggling. And then, of course, there's the lower rating of those facilities. So maybe just the importance of, this Medicaid and all of that when it relates to those rural communities and those folks in those areas struggling.
Yeah, Sarah, thank you. I've been working for years to try to expand and strengthen healthcare access in rural Georgia and to support rural hospitals, many of which have closed already in the last 15 years across our state. And this law is going to deepen those challenges in rural Georgia. It's going to undermine the operating finances for hospitals and clinics and nursing homes. And it's going to put residents of rural Georgia, including seniors in rural Georgia, at risk.
Thank you so much.
Of course.
Sure.
Thank you, Sarah. Tamar, over to you.
Tamar, long time no see.
How have you been?
Good.
So my question is, short of repealing this law, which I know Democrats don't have the votes to do right now, what can be done from your position in the Senate, or maybe on the state level in Georgia to help better this situation for nursing homes?
Well, in fact, we will have the opportunity for the Congress to repeal these dangerous and destructive provisions. For example, there will likely be a healthcare legislative package at the end of this year. That will be an opportunity for my Republican colleagues to undo some of this damage before too many seniors are put at risk. They are in control of the Congress and the executive branch. And they need to work with us to save nursing homes and hospitals across the country from closure. They just passed this budget. They were warned for months. We had hospital administrators, nursing home leadership, nurses, doctors, teachers, food pantry leaders, all came to Washington repeatedly in recent months, and they warned members of Congress that if this bill became law, it would put hospitals and nursing homes and nutrition programs and school districts at risk. They proceeded to pass this law anyway. This damage is happening. This damage is coming. They need to work with us to undo some of the damage that's already been done.
And I know there's, the state could do things in the budget to maybe backfill some of those cuts. Are you going to be advocating for leaders here to do any of that?
It's going to require all of us at the local, state, and federal level. But again, this is unnecessary and avoidable harm to seniors in Georgia. This is a policy decision that's been made in Washington in order to fund tax cuts mostly for the very wealthy. So in order to fund tax cuts mostly for the very wealthy, they are slashing funding for nursing homes, hospitals, health clinics, school nutrition programs. things my constituents rely on. And it is not too late, and it is never too late, Tamar, for Congress to reverse course, and we should.
Perfect. Thank you, Tamar. Over now to Veronica. Then we'll get to Brittany and then Tia.
Thanks, Jake. Hello, Senator. Long time.
Hey, how are you, Veronica?
I'm doing all right. I'm hoping you're doing well. I'm curious to know if there is a timeline for how soon this so-called gutting is going to happen. I think I'm seeing different timelines for when this actual, the provisions of the bill actually start to hit the ground or, hit Americans.
Yeah, it depends on the provision. Some of it more or less immediately, some of it at the beginning of next year, some of it over the next 18 to 24 months. But if you're running a hospital or a nursing home, that financial cliff is fast approaching. And right now, as we speak, as a result of policy decisions by the administration, funds for after-school programming are frozen. The nutrition programs are likely to take an immediate hit at the beginning of the next year. Georgians face the prospect of a potential multi-$1,000 increase in their health insurance premiums next year. These Medicaid cuts are going to begin taking effect over the next 18 to 24 months, and that fiscal cliff for hospitals and nursing homes is fast approaching. That's why we have to act with urgency, because this is happening so soon.
Senator, do you talk with your Republican colleagues about why they support this legislation?
Yeah, look, I think we all know why they support it. It's because the White House ordered them to pass it. I would encourage all of you to play for your audiences, and I'll have my office provide this to you. That moment where my Republican colleague, Senator Tom Tillis, Republican United States Senator, stood up on the floor of the Senate, again, a Republican senator, and said, this is going to throw 633,000 North Carolinians off of their health coverage, and I will not support it. He was willing to take that stand, but not many were. And so they passed this law knowing that it would undermine the health and safety of working and middle-class Georgians and seniors and kids. And my message again is it's not too late to undo this damage, and we must undo this damage.
Thank you.
Thank you, Veronica. I will now go to Brittany and then Tia.
Hi, Senator Ossoff. So this is a very Columbus, probably specific question. At least one of the nursing homes in Columbus that was on that list has been under fire for probably like the last 5-ish years for, consistent allegations of abuse and neglect. And they currently have a warning on the Medicaid website for this. What would you say to this group of people, locally that have been working to try to get that facility closed, who might look at this and say, hey, this is inadvertently doing something that we've been trying to work towards, for a while now, who look at it and they're saying this is already, a struggling and failing facility to begin with and was what they would feel like is already unsafe for their loved ones?
Brittany, I don't know the details of the particular case you're referring to. And again, this particular study was produced by a school of public health. It is one of many studies and assessments that's been produced in recent months, warning of the impact on nursing homes, not one particular nursing home, nursing homes across the country. The decision that Congress made, a partisan decision, was to put hundreds of nursing homes across the United States in financial jeopardy. Hundreds, and potentially dozens in Georgia. So this is much, much bigger than any particular facility. This is about whether or not the United States Congress, elected politicians, are going to abandon Georgia seniors and America's seniors and put nursing homes at risk of closure in order to cut taxes for the wealthiest people in the country.
Thank you, Britt. Of course, thank you, Brittany. And we will finish it up with Tia.
Tia, what
Last
you
but
got?
not least, ever.
Hi, Senator Ossoff.
Hey.
Thanks for the time. And even though my question's off topic, it kind of relates because you've been bringing up where, you say there is an opportunity to reevaluate these cuts. There's an opportunity for Congress to listen to the concerns raised about the big, beautiful bill. But your counterparts in the House, are stymied. There's been kind of, they're going home on recess early because of the controversy over the Epstein files. So I wanted to know if you had any thoughts just about kind of how, at least on the House side, it seems like they're not doing much of anything right now with so many issues like appropriations on the table because of this controversy.
It is almost unbelievable beyond imagination that the United States House of Representatives would decide to quit working and go home for the entire summer just to avoid a vote on whether to release documents related to Jeffrey Epstein. It's unbelievable. And that's my comment to you.